HIV, a disease that started with a seemingly harmless cough, but is now forever tied with death itself.
Exactly what is this disease? How did it start? And how can we end this crisis that has lasted nearly a century? I am Kate Manalili.
And I am Jana Lingad. This is Positive. Today, we talk all things HIV and AIDS.
A lexicon. What is HIV or AIDS? Although they are sometimes used interchangeably, HIV and AIDS are in fact not the same. HIV or human immunodeficiency virus is a virus that can lead to immune system deterioration. It is a viral infection that over time destroys white blood cells called CD4+, lymphocytes, which protects the body against foreign cells, infections, organisms, and cancer. HIV is potentially transmittable when a person has close contact with a certain body fluids that contains the virus or cells with the virus. The body fluids that transmit HIV includes blood, semen, and vaginal fluids.
HIV is a virus, while AIDS, which is short for Acquired Immunodeficiency Syndrome, is a condition. Contracting HIV can lead to the development of AIDS. It is a complex condition with symptoms that vary from person to person. AIDS manifests as a collection of symptoms that occur as the HIV infection compromises more T cells, which are types of white blood cells. The lack of functioning T cells increases the occurrence of opportunistic infections.
If that information is too much for you to take in, just remember that AIDS is a disease that is caused by HIV, which is a virus. A person can have HIV and never develop AIDS, but anyone who's been diagnosed with AIDS has HIV.
Now, let us talk about how HIV spreads. Kate has already touched on this issue earlier, saying that HIV is potentially transmittable when a person has close contact with certain body fluids like blood, semen, and vaginal fluids. But these fluids can enter your body in many different ways. First is by having sex. You may become infected if you have vaginal, anal, or oral sex with an infected partner whose blood, semen, or vaginal secretions enter your body. In fact, this is the most common way to contract the virus. Another is by sharing needles. Sharing contaminated IV drug paraphernalia such as needles and syringe, puts you at high risk of HIV and other infectious diseases, including but not limited to hepatitis.
Another way of getting infected by HIV is from blood transfusions, a procedure in which whole blood or parts of blood are put into a patient's bloodstream through a vein. American hospitals and blood banks now screen the blood supply for HIV antibodies, so this risk is very small. Lastly, you can also get HIV from your biological mother. Infected mothers can pass the virus onto their babies during pregnancy or delivery or through breastfeeding. However, mothers who are HIV positive and get regular treatment for the infection during pregnancy can significantly lower the risk of transferring the disease to their babies. It is also important to know that as long as no blood is present, HIV does not spread through urine, human manure, spit, vomit, sweat, coughing or sneezing, holding hands, and sharing eating utensils.
Now that we've talked about how HIV spreads, let's talk about how you can protect yourself from getting the virus. Although there's no vaccine to prevent HIV infection and no cure for AIDS, you can protect yourself and others from infection. The best way to protect yourself from HIV is to not have sex. But of course, celibacy is often difficult for many people and couples since sexual attraction is usually a big component of romantic relationships. So if you decide to have sex, use a new condom every time you have anal or vaginal sex. You should also consider reducing the number of sexual partners you have. And of course, you should also get tested for HIV and make sure all partners do too. If you do test positive, tell all your sexual partners, current and past. They'll need to be tested too.
More ways of preventing yourself from getting infected include using a clean needle. If you're pregnant, considering on keeping the baby, and HIV positive, get medical care right away for you may pass the infection to your baby. But if you receive treatment during pregnancy, you can significantly cut your baby's risk. Another thing is that everyone who is sexually active should do is get tested and treated for STDs or sexually transmitted disease because having an STD increases the risk of HIV infection.
Now, let's move on to the symptoms of this disease. The symptoms of HIV and AIDS vary depending on the person infected and depending on the stage of the infection. HIV has 3 stages. First, acute HIV infection. Second, chronic HIV infection. And lastly, AIDS. Some people infected by HIV develop a flu-like illness within 2 to 4 weeks after the virus enters your body. This is the first stage and it can last for a few weeks. Possible signs and symptoms include fever, headache, muscle aches, and joint pain, rash, sore throat, and painful mouth sores, swollen lymph glands, mainly on the neck, diarrhea, weight loss, cough, and night sweats.
These symptoms can be so mild that you might not even notice them. However, the amount of virus in your bloodstream is quite high at this time. As a result, the infection spreads more easily during primary infections than during the next stage, chronic HIV. In this stage of infection, HIV is still present in the body and in white blood cells. However, many people may not have any symptoms or infections during this time. This stage can last for many years if you're not receiving antiretroviral therapy or ART. ART is the treatment of people infected with HIV using anti-HIV drugs, which brings us to our next topic, drugs and medication for HIV.
Currently, there's no cure for HIV or AIDS. Once you have the infection, your body cannot get rid of it. However, there are many medications that can control HIV and prevent complications. These medications are called antiretroviral therapy or ART, as Kate mentioned. Everyone diagnosed with HIV should be started on ART, regardless of their stage of infection or complications. ART is usually a combination of 3 or more medications from several different drug classes, with each class blocking the virus in different ways. This approach has the best chance of lowering the amount of HIV in the blood. There are many ART options that combines 3 HIV medications into one pill taken once daily.
Taking HIV medicines does not prevent transmission of other sexually transmitted disease. HIV is treated with antiretroviral medicines which work by stopping the virus from replicating in the body. This allows the immune system to repair itself and prevent further damage. But this specific method does not work for other STDs.
So far, the drugs and medication we've talked about are taken after you have already tested positive for HIV. But what about the medications taken beforehand? This is where PrEP comes in. PrEP stands for pre-exposure prophylaxis. That means you take these medicines before HIV gets into your system or before exposure to help protect against infection. PrEP medications for HIV include Truvada and Descovy. PrEP can reduce your risk of getting HIV from sex by more than 90% and from injection drug used by more than 70%, according to the Centers for Disease Control and Prevention. Your doctor will prescribe these drugs for HIV prevention only if you don't already have HIV.
When it comes to any topic, but especially one that involves our health, it is best to be well informed. Getting new information concerning our health and well-being may be scary at first, but if you think about it, the only thing we get from this is a new sense of life and a true lexicon of knowledge. A false notion. Living with HIV and the stigmas that comes with it. Although many people associate HIV and AIDS with the past, perhaps even something people from 80s and 90s experienced, this is simply not true. There are still millions of people who suffer from this disease today, 37.7 million people to be exact. HIV is not a thing of the past. It is something people still go through today, and with living as an HIV positive person comes living with the hurtful stigmas and misconceptions. Here is Trixie Montemayor to talk more about these misconceptions.
Kate is right. With HIV comes misconception, but what exactly is misconception? A misconception is a view or opinion that is incorrect because it is based on faulty thinking or understanding. Here are just some of the most common misconceptions regarding HIV or AIDS. HIV can be transferred by kissing. It's extremely unlikely that you will contract HIV from kissing, as HIV is not spread through the saliva. Although if the person you are kissing has sore or bleeding gums, then there is an elevated risk. People who have HIV cannot have sex with people who do not have HIV. You can have sex with a person who doesn't have your same HIV status. And there are numbers of things that you can do to help prevent HIV transmission during sex. This obviously includes condoms, but also when someone is living with HIV, is on treatment, and achieves undetectable viral load, the risk of transmitting the virus is almost zero. This is where being untransmittable or undetectable comes in. Here is Alia Oliveros for more details.
Thank you, Trixie. When taken as prescribed, HIV medication can decrease the amount of HIV present in a person's blood to be too low to measure. This is called being undetectable.
Being undetectable prevents HIV disease from progressing and allows people to live long and healthy lives. It also protects the health of their sex partners. People cannot pass HIV through sex when they have undetectable levels of HIV. This prevention method is estimated to be 100% effective as long as the person living with HIV takes their medication as prescribed and gets and stays undetectable. Basically, being undetectable means that someone who has HIV but is undetectable is safe to have sex with a person who is HIV negative. Though, using a condom and practicing safe sex is still recommended, of course. This concept is known as undetectable equals untransmissible, or U equals U. Becoming undetectable can take up to 6 months after starting HIV medication.
Now, let's shift our focus to the stigmas and discrimination that people who are HIV positive experience. Here to help us with this topic is Diana Alquero.
HIV stigma are negative attitudes and beliefs about people with HIV. It is the prejudice that comes with labeling an individual as part of a group that is believed to be socially unacceptable. Here are a few examples. Believing that only certain groups of people can get HIV. Making moral judgments about people who take steps to prevent HIV transmission. And thinking that people deserve to get HIV because of their choices. Now let's discuss what discrimination is. And yes, there is a difference between this and stigmas. While stigma refers to an attitude or belief, discrimination is the behavior that results from these attitudes or beliefs. HIV discrimination is the act of treating people living with HIV differently than those without HIV. Here are a few examples. A healthcare professional refusing to provide care or services to a person living with HIV. Refusing casual contact with someone living with HIV. Socially isolating a member of a community because they are HIV positive. Referring to people as HIVers or positives. In 35% of countries with available data, over 50% of people report having discriminatory attitudes towards people living with HIV. Those most at risk to HIV continue to face stigma and discrimination based on their actual or perceived health status, race, socio-economic status, age, sex, sexual orientation, or gender identity or other grounds. So clearly, this is a topic that we need to nip in the bud. In order to do that, we need to find out how and where stigmas and discrimination regarding HIV or AIDS come from. Here is Alwin Padua to talk about this subject.
HIV stigma is rooted in a fear of HIV. Many of our ideas about HIV come from the HIV images that first appeared in early 1980s. There are still misconceptions about how HIV is transmitted and what it means to live with HIV today. The lack of information awareness combined with outdated beliefs lead people to fear getting HIV. Additionally, many people think of HIV as a disease that only certain groups get, specifically the queer community. This leads to negative value judged about people who are living with HIV. HIV stigma and discrimination affect the emotional well-being and mental health of people living with HIV. People living with HIV often internalize the stigma they experience and begin to develop a negative self-image. After hearing this information, it is clear that stigma and discrimination is a harmful thing that has to end. So how do we do that? Adopting a human rights approach to HIV and AIDS is in the best interest of public health and is the key to eradicating stigma and discrimination. We should also talk openly about HIV to help normalize the subject. It also provides opportunities to correct misconceptions and help others learn more about HIV. But be mindful about how you talk about HIV and people living with HIV. The use of specific programs that emphasize the rights of people living with HIV is another well-documented way of eradicating stigma.
Living with HIV or AIDS cannot be easy. With all the misconceptions, stigmas, and discrimination, it makes one wonder, which is the true virus here? The one that comes from other people's bodily fluids, or the one that comes from other people's harmful false notions? Now, let us hear the story of Christian, a 30-year-old man who isn't aware of the health issue he was facing when he experienced rashes and persistent cough with blood. Eventually, he found out he had HIV. What are the early symptoms that you experienced and what did you do that time?
Yung first is, may rashes siya. So, nag self-medicate. Akala ko lang kasi it's a normal thing. Later ko na pala siya nalaman na yun pala yung pinakauna, yung parang nag-manifest. Then later on, yung yung consistent na yung cough until may na siya, may mga blood. That was 2014.
What changes did you experience in your physical appearance?
Ang laki ng changes sa self ko that time kasi pumayat talaga ako ng husto. Hindi ako lumalabas kahit gusto ni nanay na lumabas ako. Pero sabi ko ayoko kasi nga parang that time is nahihiya ako baka ano sabihin nila yung mga kapitbahay.
Did you take a test immediately when you started noticing symptoms?
Actually before, I don't have any idea saan ako pwede magpa-test. Kasi wala akong other source or wala akong information saan ba pwede. Kasi that time pala, hindi pa pala na-establish yung hack dito sa sa Marbel. So yung available lang is sa Davao.
Who accompanied you during those times?
Sinamahan kasi ako ni nanay. So I feel sad para kay nanay, not for myself. Because nanay doesn't know na what I'm doing in my life. Parang siguro kulang lang ako sa parang care. Parang I tried to find it to other people.
What do you want to say to people who are going through the same situation?
To those people nga na hindi pa aware sa kanilang status, kumbaga na lang, help yourself na lang talaga na to get tested. At least kung di mo man siya ma-open up sa parents mo, sa friends mo, at least we are here, registered nurses sa HAC, and then your fellow PLHIV, we can help you out.
A solution. How did the world combat HIV and AIDS?
In this last part of our documentary, we're going to talk about how the Philippine government, the WHO, and the UN combat HIV or AIDS. First, let's start with our own country. The Philippine government has confronted the problem of HIV or AIDS aggressively with an action plan that includes an emphasis on the response of the local government agencies, involvement and support of non-governmental organizations or NGOs, incorporation of HIV or AIDS education into the school curriculum, and laws forbidding discrimination against people with HIV or AIDS or belonging to risk groups. Locals and international NGOs have been actively involved in the prevention of HIV or AIDS and support of affected individuals. Although the Philippines is currently experiencing low rates of HIV or AIDS, we need to be prepared for the possibility of an explosive increase in the spread of HIV or AIDS. Vietnam and Indonesia provide examples of delayed epidemics of HIV or AIDS that could also occur here.
Now, let's move on to WHO and UN. In September 2003, WHO, UNAIDS, and the Global Fund to Fight AIDS, Tuberculosis, and Malaria declared lack of access to treatment with antiretroviral medicines a global health emergency. In response, these organizations and their partners launched an effort to provide 3 million people in developing countries with antiretroviral therapy by the end of 2005. By March 2004, 48 of the countries with the highest burden of HIV and AIDS had expressed their commitment to rapid treatment, expansion, and requested technical cooperation in designing the implementing scale of programs.
HIV is a virus that spreads not only through our bodies, but also through the community and the world at large. It is a serious problem that needs serious solution. Though we have achieved many achievements when it comes to our knowledge and medication of HIV, we still have a long way to go. HIV and AIDS started their song many years ago, but its echoes are still being heard today, and they will be heard for many years to come. Again, I am Jana Ingad.
And I am Kate Manalili. With this simple documentary, we hope to have educated you regarding HIV and AIDS. We urge you to research more about this topic and share the information you learned today. This is Positive, officially saying goodbye.